Welcome to Stress Free IEP, the show where we help families build their village to raise their neurodivergent children with confidence and support. I'm your host, Frances Shefter, special education attorney, advocate, and fellow parent, walking this journey with you. Each week, we shine a light on the professionals, resources, and real world strategies that can empower you to navigate the IEP process and beyond without stress. Whether you're tuning in live on Facebook or YouTube or listening later on your favorite podcast app, we're so glad you're here. Let's dive in and meet today's amazing guest. Dr. Jessica Hasson is a licensed clinical psychologist. In addition to being licensed in Maryland, Virginia, and Washington, D.C., she is authorized to practice telehealth in 42 states and U.S. territories via the Psychological Interjurisdictional Compact, or PsyPact, I think I've heard it called. She has two decades of experience conducting a variety of psychological evaluations, including, but not limited to, diagnostic assessments, therapeutic assessments, psychological assessments, adult autism and ADHD evaluations, and forensic evaluations. Additionally, she conducts workshops on psychological evaluations for licensed psychologists, local universities, psychological associations, state hospitals, and attorneys. She has testified in court in the DC metro area in education, family law, criminal, and civil proceedings. Further, Dr. Hasson has published academic papers on assessment, presented research at national and state level conferences, and has a published book on psychological assessment called Essentials of Rorschach Assessment, Comprehensive Systems, and RPAS. Dr. Hasson, welcome to the show.
Thank you for having me.
So I know one of the first questions that people always ask is like, what's the difference between an outside psychologist and a school evaluation?
There's a lot. The first thing is really the purpose of them. So the school-based evaluations are really focused in on and really honed in on, is there an educational need? So they're looking to see if the student meets classification under IDEA for special education services. And I'm specifically saying classification and not diagnosis, because the school-based evaluations are not designed to diagnose, they are designed to see if they meet that classification. Now, the outside evaluations are different. We're not just looking to see if there's an educational need. We are looking broader based. Often we're looking at diagnosis, not always, but we're looking at diagnosis, treatment needs, and yes, absolutely, we could come up with some educational needs associated with it. So I think one of the biggest differences is the scope and what the focus really is.
Right.
So again, the educational, the school-based ones are really based on education.
And just the educational impact. And one of the things I say also is that with the education ones, they have the school psychologists do the cognitive and behavioral, then they have the speech do the speech, and then OT do the OT, and the special ed teacher do the educational. So you kind of get it all piecemealed, where I've seen the private evaluations, it's all together, and the private evaluator knows everything and can see the interactions between the psychological cognitive and the academic performance a lot easier and can dig deeper, right? Than if they see something going on.
Yeah, absolutely. And I'll say that, and there are times like I'm not a speech language pathologist. We do some like receptive and expressive language testing, but for like articulation things, we definitely do, stay in our lane, and we have the speech paths work their magic. But yeah, one of the things that we can do on the private evaluator end is, if I'm seeing something that may not be an educational need, but if I'm seeing a treatment need, I can jump into that. Or if I'm seeing something that, let's say, is not quite an educational need, but maybe an educational need in the future, I can look at that. So if I'm seeing, we sometimes talk about red flags, but I'll call them pink flags. So things that could develop into something else, and say, if we address this now, we may be able to stop something from happening in middle school or high school. Or a lot of times I talk about neurodivergent kids hitting a wall, and I'll say, hey, we're starting to see signs of this. And chances are your child may not meet criteria for special education services right now. However, if we do these other things, we may make it so they never need it. So let's address these earlier on signs.
Which is, I had my other show, and I'm trying to remember if it was last week or the week before, but talking about the importance of early childhood education about don't do the wait and see, that let's dig in and see what's really going on, because as we know, kids are sponges at the younger age and really learn more, and so the more services we get as a younger age, the less it's needed in the future. Not saying that you can grow out of dyslexia, autism, ADHD, all of that stuff, but you learn how to cope better. And sometimes you learn how to adjust enough that it doesn't impact your life, right?
But yeah, the other thing we can do is if we identify a child earlier, like let's say the child's autistic or has ADHD, we can work with the parents in the school system earlier and the other important groups in the child's life, whether it's uh, a spiritual leader, things like that, daycare providers, to help them make the accommodations that the child needs. So we could start creative seating really early. We could start with some of the sensory toys early. We can start with the breaks early. And this one normalizes this for the child, and it normalizes for the family that this is their child. This is their child's wonderful brain and how it works. And let's put in those strategies in the environment early on. So this child really is not just surviving, but actually thriving and ideally flourishing. So let's see what they can do.
Right. Exactly. And I love that you say normalizing it, because one of the things, a lot of parents we go through, like, do we tell the kids? Do we not tell the kids? How do we do it? With both of my girls, I said that we're just learning how your brain works. Everybody's brain works differently. And we're learning how your brain works, so that we can learn better together and things like that. I know with the normalization, as they call it, or the what's going on now with the diversity, um, that a lot of people are asking about, well, what's neurodivergent affirming assessments as opposed to just regular assessments?
Yeah, that's a big topic. So mm, I guess probably best way to start is to talk about what neurodivergence actually is, because I think it's a word getting thrown around a lot. And neurodivergence is just brains are different. There's a diversity in brains. And it's not that one brain's better than another or anything like that. It's we all have different brains. We all have different skill sets. We all have different areas that are highly developed and maybe some areas of difference. And so the neurodivergent affirming movement is more than just using certain buzzwords. Um, it's it's an entire approach that reconceptualizes some of these different conditions, autism, ADHD, things like that, as brain differences rather than as deficits. So my field, like a lot of fields in healthcare, is based off of has fallen into the medical model, where deviations from the norm are considered deficits, and they're not. We know that somebody who has ADHD or an ADHDer flourishes in certain situations. And this is not everybody with ADHD, but oftentimes individuals with ADHD do pretty well in chaos. Like they work great in certain environments, like working in a working in a kitchen, a lot of first responders, things like that. Classroom, not so much.
Right.
Classroom setting can be difficult, but that's just an example of finding the right fit for the brain. So a lot of neurodivergent affirming practice is looking for the person environment fit, looking for the right fit for the person, their brain, and the environment. The other thing that we do is we do more of it's a collaborative approach. So it's designed not to be, I'm the expert, I'm going to find out what's different or wrong about you. Instead, it's like you said, we're going to figure out how your brain works. That's what my job is. My job is to work with the person, the family, and to figure out how their brain works in a collaborative way. We pay a lot of attention to their lived experience, what their experience is. We have our test results, and we kind of take them and combine them, and we work with the person and kind of figure out what's happening. It's also very strengths based. Now, I guess the downside of this, not that there's a downside, but from a systems perspective, when you're looking at like disability services and things like that, a very strengths-based approach evaluation sometimes backfires where
Right.
they'll say,
Yep.
but there's no deficit. And I'll say, there's a difference. And yes, when we
Right.
look at this person's brain, this is an area that's less developed for them. This is how the environment should accommodate them. So that's been kind of an interesting place to navigate.
Yeah, it's so interesting that you say that because my older daughter was like, "Well, but mom, doesn't everybody's brain work differently?" I'm like, "Yes, they do, 100%." She's like, "Well, then why do I need resource room? Why do I need an IEP?" And it's just, it's frustrating because unfortunately, she needs these because our school systems haven't adjusted to make the environments appropriate for these kids in a way that we don't necessarily need the individualized stuff. Do you know what I mean? Not saying that IEP should go away, but a resource room teaching executive functioning. I'm sorry, why isn't that standard for every middle school child? Right?
I mean, yes. I'm just thinking of
And
my middle schoolers, and thank you to all the middle school teachers out there. You guys deserve more money than what you get.
yeah, that's it.
But no, I mean, in all seriousness, like there are certain things that really should be taught across the board. I think executive functioning skills is absolutely one of them. And figuring out what sort of executive functioning strategies work for the individual brain. Like planners are not for everybody.
No.
I'm a
Yeah.
huge proponent of alarms on the phone. Those things are wonderful. So
I
there's,
ignore mine, so that doesn't work for me, right?
but see, and again, that's a difference,
Right.
right?
I need to have a task listed in my task thing in Clio, and that's when it gets done. Yeah. So, but right, all brains work differently.
Exactly. And and granted, like in a school system where there's 20, 30, for some, hopefully not more than 30 kids in a class,
Right,
it is hard to tailor it individually to each student. But there are things that can be done that make the entire environment really friendlier for all the students.
right,
Creative seating, a lot of students benefit from. And by creative seating, there's like inclusion seating, so larger chairs, so the kids can sit crisscross applesauce on them
yeah,
as well. There's yoga ball chairs, so the yoga ball but actually locked down because I mean sometimes
right, they have those, yeah,
they go
those
bouncing away sometimes.
yeah,
Or
or the kids
like
go rolling
standing,
off.
yeah, exactly. Standing desks, or the ability to like stand or move around a little bit. And the more that we normalize this younger, the more it gets normalized at as an adult as well.
Right,
So, but again, like having sensory toys, and there's just so much more that we could do that makes the environment more friendly for our neurodivergent students. And it makes it more friendly for everybody too, frankly.
right, right, exactly. I mean, like, there's things like the movement breaks, and, a lot of teachers will say, "Oh, we do that naturally, it's kindergarten." I'm like, "And I understand that, you do that naturally, but not every teacher does that naturally, and so we do have to put it in the IEP." Um, but in reality, every kindergarten teacher should be doing a movement break because these are little ones, they're not made to sit in a seat for 6 hours a day.
Yeah, and even like first, second grade, you know,
Yeah,
they do. They absolutely they need to move, they need to play. That's really it's not only part of childhood, but it's it's also time where they learn some of these other skills.
right,
So, our kids spend a lot of time in school, and that's where they learn not only academics, but they learn critical thinking skills, they learn interpersonal skills, they learn navigation, they learn self-advocacy, and they need the chance all kids need the chance to do it, not just the kids that fit into that neurotypical box.
right, right. And in middle school and high school, it's built in, obviously, because you change classes, so it's a
Mhm.
little bit different. But like in elementary school, sometimes it amazes me on how long teachers expect the kids to sit. And I don't blame the teachers because a lot of times it's like, well, this is the curriculum we have to do, and this is the material we have to get through, and da 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 da, which is frustrating, which is a big part of why I left the classroom. But because it wasn't about me and teaching the kids.
Yeah.
But there's got to be that middle ground to find what works for our kids that works for everybody, you know?
Yeah, and I think there are definitely middle grounds. It's just a matter of us breaking through some of the way it's always been done, so we have,
Right.
like, it's always been done this way. It doesn't mean it has to always be done that way.
Right. Yep. Exactly. So a big question that happens with me a lot, or that I see, is that, the triennial review. So
Mhm.
IDEA requires a triennial review, which means every 3 years eligibility needs to be looked at again. And a lot of times schools will be like, oh, we all agree that he still has autism and still is eligible for special ed, right? Right. Okay, great. We don't need to do assessments. You're shaking your head. That's what I say also. I'm like, what do you mean you don't have to do assessments? Like, right?
Yeah,
We do
so
still. Why?
yeah, okay, so I'm not a huge proponent of every 3 years we test,
Right.
right? I view we test when we need to,
Mhm.
and so I would say, like, let's say a child is identified as a child in need of special education services in kindergarten. The triennial would be, like, 3rd grade.
Right.
They may just be able to say at that point, "Okay, things are progressing, let's see what happens." But that kid should be reevaluated before the launch to middle school.
Right.
So we have certain touch points where the kid's world is going to change significantly. One
Mhm.
of them is the launch to middle school, because all of a sudden they're going from really being in the same classroom, or maybe I know a lot of elementary schools will switch the students in 4th and 5th grade. So
Right.
maybe they'll go somewhere else for math or reading. But in middle school, they're switching every, I don't even remember how often they were switching. It's a lot. I think they have some.
6 to between 6 and 8 periods depending on
Yeah,
middle school, but yeah, it's a
yeah.
lot.
And then another one is the launch to high school.
Right.
And
And
then
that's what I would
I
say. Yep.
I always argue there needs to be one to the launch to,
Adulthood.
well, I was gonna say older
Yep.
adolescence, but
Yep. Oh, yeah.
yeah. So
But yeah,
launch,
out of high school, what's after school.
exactly.
Yeah.
Exactly. So if we're looking at a student that's going to be looking at a career, those classroom accommodations are not this, they you don't get extra time at work.
Right. Right.
So we need to figure out, like, what do they need at the employment level. For those going to college, college is a different beast altogether.
Yeah.
So they're not in class from like 7:30 to 2:30 anymore. They choose their schedule. There's there's a lot more that goes into that. So there does need to be, I would argue, another evaluation at that point. And
100%.
when we're also even thinking, like, for college or employment accommodations, they're not going to take an evaluation that was done back when the kid was 12.
Exactly. It has to be within, my experience has been it has to be at least, less than 2 years old, if not a year.
Yeah, and
That's what I always say.
I've seen within the past year, the longest
Mhm.
I've seen is 5 years.
Wow.
Um,
Okay.
yeah, but that was actually that was a graduate school thing, so
Okay.
I think they were
So
opening
that's
it to, like, their senior year in high school, essentially.
yeah, that
Yeah,
makes sense.
but again, when we're thinking about evaluations, we have to think about changes. So there's a huge developmental shift that happens when you
Right.
enter into the tweenhood, and then adolescence, and then older adolescence, and then adulthood. There's actual brain shifts that occur. So
Yeah.
the needs change over time. So just because a child with autism was receiving X, Y, and Z services in elementary school, the needs change significantly in middle school. Or
Exactly.
you have autistic kids that don't meet criteria for an IEP in elementary school, but may in middle school because of the increased social demands, the increased executive functioning demands, things like that. So
Right.
we need to look at this.
Yeah. No, and I always recommend every 3 years, you gotta do, for me, academics. I should clarify. Depending on the child and the intellectual level where they are, academics could be important.
Mhm.
For others, behavioral.
Yeah.
But, like, those are the 2 things, like, how can you educationally plan? Because, yes, kindergarten and 3rd grader, is there much change? Cognitively, no, but behavior-wise and academic-wise, that's a 3-year period. Like, how can you educationally plan? And, teachers are like, "Oh, well, we have the standardized test scores." Well, guess what? Some of us don't do well in standardized tests. I'm one of them, right? Like,
Yeah.
you need something else. Another data point.
Yeah. And there's also the kids on the other end of the spectrum that do extremely well on standardized testing, but it's not
Right.
showing up in their grades in the classroom and things like that too.
Exactly. Exactly.
Yeah, and the other and just going back to the reevaluations, even things like cognitive abilities, like, they're not stable when they're little, like, they're just not.
Right. Yeah.
Um,
I
I
think
I
I
mean,
heard like, is it like 8 years old that it kind of stabilizes, or is that young?
it's young,
Oh, okay.
it depends on who you ask is probably.
Gotcha. I didn't know.
But even then, like when we do an IQ test or a cognitive abilities test, so much other things factor into that. So
Right.
if the child's in a depressive episode or really anxious or has ADHD that's unaccommodated, those all impact their scores. If they haven't slept, if they haven't ate, that impacts their scores too. So it
Right.
does help to have multiple assessments of their cognitive functioning.
That makes sense. Well, and it's also, doing the assessments when the teachers say, oh, well, we have the classwork, we have the assessments and stuff. IDEA is very clear that you need to have more than one data point. And so classroom observation and standardized tests, okay, yeah, that's two, but like the more data points, the better, because as you said, it could have been an off day. It could have been the teacher and the kid don't get along. So there's issues there. It could just be just not a good whatever for the child. And it's just, let's see, it's like as standardized tests and even psychological testing, it's a snapshot of where the child is
Mhm.
right then and there. And so it needs to be looked at everything.
Yeah, and it does the other thing with the standardized testing that we do, that's the psychological testing, is that it's not necessarily based on it's actually not based on a state requirement or anything like that. These are what we call nationally normed tests. So these are comparing the child to other people their age, so across the entire United States. So it gives a different data point
Right.
as well.
Right. Yeah. Um, so I'm just thinking about our listeners and them going, well, how do we know what evaluations are needed? So we said evaluations we know going into middle school and going into high school. What would you recommend? Like if a parent, they're coming up for the triennial review, or even if they're not, they're requesting it. They're like, well, wait a minute, I think we need to do assessments. What would you recommend, like bare minimum of assessments?
I think it depends on the kid, and
Yeah.
I'm a huge proponent of tailoring the battery to the kid, and I realize in the school system, they can't necessarily do this. In the
Right.
clinical realm, outside the school system, we can do it. So, but at a bare minimum, if we're looking at a kid, like, let's say that has an SLD, so a kid with a learning disability or a learning difference, cognitive testing, academic testing. I'd also screen for emotional functioning things because especially
Mhm.
as they get older and they get more aware that what the pull-out services mean, like if they're getting resource room, if they have the teacher redirecting them more often, if there's anything that brings attention to them, they start realizing like, okay, I'm different. And they may not see it as different in a good way at that moment.
Yeah. Yeah.
And so we wanna look to see if there's anxiety, depression, things like that. We also know that certain things get missed in kids. So my field has historically been really bad at identifying, uh, individuals who are Black and brown and women, those of us assigned female at birth, with pretty much everything. I'm not
Yeah.
even gonna try to be I'm not even trying
Right.
to I'm not gonna
No, because
sugarcoat it.
it's different. Right. No.
Um,
Yeah.
so we do. We see a lot of I get a lot of girls who are 13, 14, 15 years old that they have ADHD or dyslexia. I've seen cases of dyslexia that I'm diagnosing at 17 or
Yep.
18. And
Because they've
because
accommodated in other ways. They've masked and they've readjusted to make it work.
right, exactly. And so that's another reason to kind of get these other perspectives on here. I
Yeah.
love doing, like, broad-based personality and emotional functioning measures across the age spans because that lets me see if there's anything we're missing. Because I think a lot of times in these evaluations, we're looking to see, like, what we know is already there. We wanna make sure that we're not missing anything
Right.
too. So I do
Yeah.
so to go back to your base minimum, I would say cognitive testing, academic testing, assuming school system, and some form of broad-based personality emotional functioning measure. The BASC gets used a lot in the school system,
Yeah.
and we use it too. So
Baskin Connors is the other one
yeah,
I see a
and the
lot.
Connors, yeah, and the Connors, there's a couple of Connors, but one of them specific for ADHD.
Right. Um, so you say cognitive. Is there like okay, at this point you don't need to do cognitive anymore, or only every 5 years? Is there like some kind of rule of thumb? Because a lot of times, almost always, schools give pushback about giving cognitive again because they say cognitive doesn't change.
Cognitive absolutely changes
Okay.
because again, it's a snapshot. So if
Right.
you get the kid on a bad day, their
Yeah.
cognitive scores are going to be lower, and we have labeling effects, self-fulfilling prophecy, all these like social psychological phenomenon that are going to impact how the person sees the kid. So
Right.
do we want the kids one bad day dictating the rest of their education?
Yeah. Yeah. That makes
And
sense.
even then, our cognitive tests, our IQ tests are changing. Like we're assessing things that we've never been able to really assess before because of technology.
Right.
And so we're actually getting different data than we've gotten before. Like we're able
Interesting.
to hone in on different aspects of cognition that it was hard for us to get to before. And this is more accessible to all of us now too. So we're doing some really cool stuff with testing now. There's so much
Yeah.
more that we can do.
And that makes it does make sense because, one of the things, as I said, I never did standardized testing well. I was awful. As a result, I didn't think I was smart, but that's a whole nother story. But like with the standardized tests and stuff, they say, oh, it's normed for everyone. But I'm sorry, you can't compare a child that's brought up in the socioeconomic you know, world of from birth, they're flying, all over the states, all over the country, with a child that was brought up in an inner city that doesn't have the socio and isn't having those same experiences. Like, how do you compare the two of them and say it's normed?
Yeah. Well, and so when our new tests come out, they do try to capture some of that, right? So
Okay,
they do try to they stratify according to census data. So they do try to catch some of that. But again, they're averaging all of this together. So they're
right.
definitely we miss things because
Yeah,
of it, but it isn't representative of everybody. So the norms, they're called norms because they're based on the quote unquote normal neurotypical. So there are definitely individuals with neurodivergence that are in the normative group, but that's not the design. The design is basically to find the average, like what is the national average. So a savvy evaluator will look at that and say like, okay, I'm testing a kid who, has been in and out of the foster care system, who, you know, we have a history of abuse. Let's look at what these scores mean for this child.
yeah,
So, is this child like to what level is trauma impacting this child's scores? To what level is a lack of accessibility, like a lack of access impacting their scores? And I'd argue we need to keep looking at what is the impact of the pandemic and the educational
yeah,
loss from the pandemic still impacting kids' scores because it absolutely is.
right. And it's interesting, I know with IDEA, they say, one of the exclusionary factors was the kid educated. And, that's I don't want to say questionable, but for kids in the foster care system,
Mhm,
I've seen so much, and sometimes they're bouncing schools. Sometimes, they don't know where they're sleeping tomorrow night. They don't know what's happening. They just bounced homes again. And so while they might be in school, they're not available for learning. They're not really learning because they don't know. And then even kids that are brought up in a lower economic, they don't know if they're going to have food the next day. And so, like, the lack of instruction is such a broad thing and so hard to hone in on, right?
mhm. Yeah, and if
So,
you
it's a
yeah, and
factor.
if you're thinking like Maslow's hierarchy of needs, we need certain
Mhm.
things, like, if you don't feel safe, you're not able to learn. If you're hungry, learning becomes more difficult.
Right.
So, yeah, so there's a whole host of factors besides just physically being in the classroom that impact all
Right.
this.
Yeah. No, and I say that all the time. It's like if you're not, think of us as an adult. If we're hungry, we get hangry.
Mhm,
If we haven't slept, we're moodier.
mhm.
We're not fully thinking through in our brain and stuff. And so what with all of our knowledge and life experience, we still struggle. So how do we think the child is that's never been taught and doesn't have the life experiences, and whether they can,
Right, and also
learn? Yeah,
they're developmentally younger. They don't have the benefit of a fully developed frontal lobe.
right, right,
They don't they don't have the emotional understanding and things like that. So we're putting a lot of pressure on these kids to act and do things in a way that they're actually just not developmentally capable of.
right. Yeah, that's so true. So I know, like, I know listeners now are probably going, yeah, great, private evaluations. Who the heck can afford that? I can't find anyone that takes insurance, or those that take insurance have an 18-month waiting list. So why is it that a lot of evaluators don't take health insurance? And are there other options?
So let's start with why a lot of us don't take insurance, and I'll be honest, I am one of the ones that does not take insurance. Insurance pays crap.
Yep.
Like, I'm just not even gonna try to make this sound nice. A lot of insurance companies reimburse less per hour for an hour of testing than they do for an hour of therapy. So for those of us that can do both, it's actually more financially lucrative for us to, if we're gonna take insurance, to do therapy.
Right.
So that's a big thing. Insurance companies, health insurance is based off medical need, meaning that in order for something to be covered, there needs to be a medical need.
Right.
So things like dyslexia are not typically seen as a medical need.
Mm,
Things like ADHD, if they're already diagnosed, is not really a medical need unless there's been some sort of treatment issue, like their treatment has stalled and something's not
right.
working. So there's actually really specific criteria we need to meet for something to be medically necessary for a testing. So that's a big thing.
That makes sense.
The other thing is often academic testing just won't be covered. And
Right.
that's because the health insurance companies say, well, that's the purview of the school.
Right. Yep. Yeah, it's
So
not a medical need, it's an educational need. They
exactly.
they both throw it back at each other.
Exactly. So what happens is you have a group of parents that are kind of in the middle.
Right.
You also, just again, thinking about sort of testing and how it works, some of the insurance companies will limit the amount of hours you can test.
Yeah.
They'll say, we will reimburse 8 hours. And it's when we're testing, we're not just testing. So we go back and we score the instruments.
Yep.
We go back, we interpret the instruments. We're looking at background data. We're looking at medical records, school records, things like that. There's a lot of time that goes into these.
Yeah.
So 8 hours
Yeah.
doesn't cut it.
Yeah. No, I know. I know. Yeah, and it's frustrating. And again, it's, like the gap is always there.
Yeah.
But it's always a challenge. But I mean, that's a whole nother show on health insurance and all of that stuff on like, affordability and stuff like that.
Yeah. Yeah.
That's a whole nother thing. But like it's, and a lot of places, I do know a lot of places will give you what they call the super bill. So you could submit
Yes.
it to your insurance. My
Mhm.
only recommendation, because I failed to do this before I had my kids tested, is make sure you have out of network coverage before you do
Yes.
it, not after.
Yeah. So
So
if
yeah,
if you have an HMO, you probably you don't have out of network coverage.
right.
It would need to be a PPO. And
I
but
mean,
there
I had
could
a
be
PPO, but still no
still
out of
no out of
network.
oh.
Yeah. Who knew?
Yeah, and sometimes there's out of network, but the deductible's ridiculous. So you
Right,
have like an out of network, but you have to hit a $15,000 deductible before they start reimbursing you for anything.
right. Yeah,
So there's a
exactly.
whole thing. Now there are evaluators that do take insurance.
Yeah.
Now I will say the waiting lists have dwindled in the area.
Oh, good.
Um, but like some of the more common places people know about Children's, Kennedy Krieger, Mount Washington
Mhm.
Pediatric, they still have substantial wait lists.
Right.
There are private practices that do testing. Some of them have shorter wait lists. The wait lists are much shorter for adults than children because there's only so many of us that test kids.
Yeah.
Is the
Oh,
other thing.
really?
Their kids are a whole different beast for testing. They're,
Interesting. Because I always get requests for adults, and I never even thought about the fact that it would be a different person that would do testing for adults versus for children.
yeah. And there's some of us like myself that test across the age span, but a lot of people do specialize in one age group or the other, or we have people that see
Interesting.
ages like 8 through 25.
Hmm.
So there's again, there's a broad variety of what we all do.
Oh, interesting. Okay. I
Yeah.
never realized that. This has been so awesome. Like I love doing my show just because I learn so much on my level, and like and with my kids and things like that. So when it comes to evaluations, what would be, I'm just trying to think of like the top three things you might tell parents that might be listening of to be mindful of, whether they're doing an outside evaluation or school evaluation. What are like the top three things you want that they should be aware of?
The primary thing is you want someone that sees your child, and I don't mean like just like
Mhm.
sits in the room with your child, but actually sees your child and treats
Okay.
them like a human being
Yeah.
and the wonderful, adorable little human that they are.
Mhm.
That's first and foremost. You wanna make sure that you're involved too.
Mm.
There should be some level of involvement for the parents. So, especially at the younger age, a lot of it is the interviews with parents and getting feedback from the parents on what they're noticing. So your observations are 100% valid and should be included as well.
Yep.
So those are the 2 big ones. And obviously you want somebody that knows what they're doing.
Right.
And I
Credentials.
will and I will say don't necessarily go off of reputation or the size of the practice or things like that, because again, you are looking for the right fit for your child. So there's wonderful large assessment practices that do great work. And there's some other small independent practices that also do great work. And it's about
Right.
finding the right fit for your kid. So making sure that you feel comfortable
Yeah.
with who's testing your child.
Right. And that, I love that you say that because that's one thing people will say things to me like, "Well, do you have somebody to recommend for testing?" I'm like, "Yes, give me some things. What do you think it's,
Mhm.
age of the child? What are you looking for?" Because there's some that are better at that learning disabilities than they are with autism or with ADHD. And like depending on where you are, like yes, everybody could do all of it technically. But
Yeah.
you want somebody that specializes more that knows, I don't know, the little intricacies that some people might miss, right?
Right, absolutely, and I'll also ask because I obviously get referrals for testing, it's what I do, but if I'm not a good fit for them, I'll say, what's the purpose of this evaluation? So, is the
Mhm.
purpose of this evaluation are you looking for an IEP for your child? So and again, no guarantees that any evaluator would find anything,
Right.
but I know some individuals who are they in their previous life, they were school psychologists, and they have since gotten licensed as a clinical. That's a great fit for that. If you're looking for
Exactly. So they know how to write the reports that the school will see the need.
right, they know
Yep.
the words.
Yep, exactly. The big difference.
But I get a lot of requests for second opinion evaluations that
Mhm.
the parents feel like something was missed. And for the second opinion evaluation, it's like, okay, what do you think's going on? Let's talk about the previous evaluation. Let's figure out what sort of evaluator you're going to feel comfortable trusting the data from. So you
Right.
want so there's a lot of questions that need to go into it, but like I said, first and foremost is like that relationship is important.
Yeah. And that's what and I always say to parents, always, parents and caregivers, trust your gut. If it
Mhm.
doesn't feel right, there's no harm in saying, "You know what? I don't think this is a good match." And
Yeah,
go find another one, right?
no, 100%. And I can say like most people in my field would rather see the person go somewhere where they feel comfortable and they feel like they're getting the services and the experience that they want versus like being in yet another environment
Totally.
where
Yep.
they feel like they don't fit in.
Yeah, exactly. That's so awesome. Thank you so much. This has been absolutely wonderful. Thank you for sharing all of your wisdom with our listeners.
Well, thank you for having me. This was fun.
Great. Thank you all for joining us on this episode of Stress Free IEP. We hope today's conversation gave you new tools, insights, or just a little more peace of mind as you support your neurodivergent child. Don't forget to subscribe so you never miss an episode. And if you found this episode helpful, please share it with someone in your village. You can always learn more and connect with me at shefterlaw.com or follow along on social media. Until next time, remember, you do not have to do it all alone.